Well, joining us now is the Minister of Health, Mark Holland. Minister, thank you for joining us.
Thanks so much for having me.
So here we are, 3 weeks to go before the March deadline on pharmacare. Still no announcement from you. How would you describe your negotiations right now with the NDP? Are you getting close to a framework deal?
We are getting close. This is obviously a very challenging process. We're talking about an enormously complex space, and we are two different parties with different ideas of how we think we should move forward. But I would say that the conversations have been very productive. The NDP, I think, has been quite reasonable in trying to find middle ground. We've got a little way left to go, but I'm hopeful that will be concluded over the next week or so, and that we'll be in a position to meet that deadline.
Okay, so the NDP has been very clear about this. Anything less than a universal and public program would be essentially a no-go for them. Is that the issue that's delaying it, that New Democrats are essentially asking for more than what your government is willing to pay for?
Well, I can't get into details around the contents of the negotiation. I mean, that is, there's a lot of movement back and forth. I think it's fair to say that, we're at a fiscally challenged time, that we have to constrain our ambition against the ability of our nation to pay for that ambition. But at the same time, we do have some really important shared objectives. We want to see folks have access to the drugs that they need at a price that is affordable for them. There's major affordability challenges in this country, and working in the space of pharma is a tremendous opportunity for us to look at reduced costs. And there's a lot of ways we can do that through policy. I look at bulk purchasing, through working with provinces and territories, and we've been able to save about $300 million a year for Canadians in their drug costs as a result of that kind of work. So there's a lot of things that we can do, and that's what I'm trying to focus on in those negotiations, the art of the possible here.
Okay, art of the possible, although there is, I guess, an example we could point to right now, because for people who don't know, there does exist a pilot program. It's taking place in PEI right now, supported by your government. And when you look at the details of that plan, it does reduce copays for many drugs, not all, and those copays are reduced for some groups, but again, not all. There's essentially a means test here. Is that the program that you want to expand nationally?
Well, I think the pilot's incredibly important, and we're learning a lot from it. And it has been very successful. We've seen copays in PEI come down to $5 for a very wide range of drugs. And it's materially improved access to pharmaceuticals in that province, and has really helped with affordability. So insofar as it's been an enormous success, we're learning from it and looking at how its lessons might be applied elsewhere. And I do think that we have to consider in real world circumstances how these models function. And it's important to see what the real world results are. So PEI has been very important. It certainly is helping to inform the discussions. It doesn't necessarily mean that's the end model we'll wind up with, but it has been very helpful.
Helpful, although, interesting, when you look at what you've done with dental care, that essentially has a means test to it, that you to qualify, you have to have a family income of less than $90,000 a year. So again, it seems a bit less than universal than what the NDP is asking for.
Well, I mean, you can't allow progress, rather perfection to be the enemy of progress. I mean, here's an example with dental care where we have 9 million people today who don't have dental coverage. And most people are very happy with the relationship they have with their dentist, who are lucky enough to have private insurance. And that has worked very effectively. So what we're seeking to do in dental care is to fill the gap, to make sure that people who don't have care get care. And we know that that's critically important, not just as a matter of social justice or having a nice smile, which is, of course, extremely important. But the fact that it is so preventative, it has such a powerful impact on whether or not somebody gets cardiovascular disease, or whether or not somebody gets diabetes, or a myriad of other chronic disease and illness. So it's so important with dental care that we fill in those gaps and make sure everybody gets care. And so, the NDP sometimes talks about, an ideal model of being some other place. But we have real people right now who need coverage, and that's what our dental care program is addressing.
Okay. Now, Jagmeet Singh says, though, if this pharmacare deadline is not met, it will be your government that is essentially walking away from the supply and confidence agreement. Is that something that you're willing to do?
Look, I understand that, publicly as part of negotiations, all sorts of things are said. But I think what Canadians are expecting is for us to work together and to find common ground. And I think those conversations have been very fruitful. So I remain exceptionally confident that when we get to the new deadline, the 1st of March, that we'll have something that makes sense, that is going to help Canadians and is going to also be respectful of the fiscal constraints that we have at this time. Speculating beyond that, I don't think it's helpful because I don't think it's reflective of where negotiations are right now.
Okay, but I am wondering though, because and I appreciate what you're saying that you are still optimistic, you're working towards this March 1st deadline, but here we have two parties that both promised pharmacare in their last campaign. If this agreement fell, would your government be willing to present its own pharmacare deal on its own, a Liberal plan, to see if that would pass in the House if the supply and confidence agreement were to come to an end?
Well, I'll tell you what, I was elected for the first time 20 years ago, and something I learned not to do is to try to predict the future. A few weeks in politics is a lifetime, and I think we need to be squarely focused on making this work. I don't really have any mind space for thinking about what we're going to do if it doesn't work, because I think the discussions are moving successfully, and I don't have any reason to believe that it will go otherwise. And circumstances in the future will be different. So I understand the excitement to speculate, and I understand the focus on sort of the politics of it. But our focus here is on getting this done for Canadians, and I really can't afford to be thinking about other scenarios other than getting this done and finding common ground. And I'm not operating on the basis of will we or will we not find an agreement with the NDP. I'm operating on what's fair to Canadians, what is going to move the ball in terms of reducing drug prices and demonstrating that we're moving towards a system that makes sense, and at the same time really respectful of taxpayer dollars. And in my experience, if you can maintain a logical, reasonable position and be the logical, reasonable party, the people will see that. And right now, the NDP is being logical. I understand they're saying some things externally to provoke negotiations, and that's common. But I remain optimistic.
Minister Mark Holland, always appreciate the time. Thank you for this.
Thank you so much. Have a wonderful day.